So we got another what if for you here, Corey.
Yep.
And it goes something like this. What if we offered treatment programs that were specific to an individual's drug use or focused solely on those specific drugs that are involved in the problem? I've seen, I guess, enough kind of one size fits all treatment programs to see that it's not always effective for everybody. And I've also noticed over the last, I don't know, whatever decade of looking at this stuff, that each individual mood altering substance, or it doesn't even have to be drugs, it could be a specific behavior, gambling, sex addiction, whatever. They all come with their own kind of little challenges, or big challenges, I should say. And they all come with different sets of tools that you can use. For instance, if you have a problem with opioids of any kind, we know we have substitution therapy that's effective for that class of drugs. We can usually stabilize somebody if that's what they're interested in doing. And we can do that with relatively low cost and not a huge, it's maybe less disruptive to the individual's life to switch onto a therapy like that. But if you look at something like cocaine use, where you've got a cocaine addiction and you want to stop using cocaine, or you want to slow down how much cocaine you're using, whatever your goal is there isn't the same type of substitution therapy. I think I've seen some studies where they've used stimulants and they've tried to do it that way, but it doesn't seem to have the same kind of effect, I guess, as it's not as effective, not as useful of a tool.
For sure.
So, and there's also differences between people who, say you've got, you're having trouble with alcohol. Usually people who've been drinking every day for a long time have certain nutrient deficiencies. They have dehydration is a common problem. We know what kind of dangers are presented with that condition. When they go into a treatment center and they go into detox, there are certain medications that are given because we know that the condition can be lethal under certain circumstances. And that's not the case for other drugs. So we know that there's differences between them, right? And we have, I think it's interesting that we have NA, AA, that like Cocaine Anonymous, those started to kind of split up into different sections when was it, in the 80s that AA kind of took off, or 90s?
Yeah, I think later than the 80s for sure.
Mm-hmm. But, I think it's okay to recognize that the mechanism of the problem of addiction is similar. It's like the same river, but the streams and creeks and everything that flow off of it, they have their own terrain, their own separate obstacles. What are your thoughts on that? Am I crazy or what?
No, I don't think you are crazy. I think that from my own experience, there's a very wide brush that is used in at least in the treatment program that I was in, where they try to, or at least rather than say a brush, a very wide net is cast, and it sort of collects everyone into the same net. And it's like you said, it's like the addiction net. But with that, it's like, I remember people in my group who they got busted for coming into work hungover, or for, their coworkers found out that they were, partying way too hard after their shift, and then they'd be coming into work hungover. Well, is that person really in the same conversation as I was? I'm not sure of that either. And time is limited in some of these programs. The coursework there's a lot of content by anyone's standards to work through for these programs. And if the content was tailored a little bit to the individual, and there were certain things that we could expand on, like with some of the personality traits. And this is why we kind of go back to our last discussion on the what ifs about, like, what if intake looked a little bit different, so that the specific needs. And I think you would start to see some trends there, like with perfectionist traits or with depressed traits, or obsessive compulsive traits, or whatever that may be. Like, are those things drivers that need to be looked at? And suddenly you'd have to have different nets out there. So you would require more content. You'd probably require more instructors or more facilitators of some of these programs. You can see where their costs would go up, and it would be a little bit more difficult for them to manage. But in terms of in terms of the value, it would, in my opinion, definitely increase the value of those programs.
I would think that there's enough evidence to at least try it. And I mean, think of what's the value of, let's say, we'll stick with opiates. Let's say you're a parent, your kid's addicted to some kind of opiate, Percocet, whatever, and you've got to choose between 3 different treatment centers, and the one is boasting a 70 plus, well-tracked. They have all the information readily available, transparent, where they're seeing the people come in, the people come out, and they're doing better. If you were able to move up into that range where you were realistically treating 70% of the individuals who come through there, and their lives were at the very least improved meaningfully, and they learned something. And if you're really lucky, they either change the way they use drugs, or they stop using drugs, whatever their preferred goal is. But I would think at this point that people would be willing to pay the extra money to have that better chance of success.
Yeah.
And we've got all this evidence pointing towards tailoring the treatment to fit the person. They individualized care is what we always say it, but rarely implement it, or we don't implement it enough. We're seeing, like, I want to mention the Caduceus Group format was built toward that end, right? It was built with the idea that healthcare professionals have different kind of problems, different obstacles that they face going back to work, stigma in the community, whatever it might be. It's not the same as it is for a dentist to have a cocaine problem, as it is for, anybody else who's not in that field.
Sure.
So those things are being recognized. And I think for me, the difference between the benefit I get from speaking with people who have very similar experiences, like speaking with somebody like you, Corey, who's been through the same type of process. You're in the healthcare industry. It's generally, it's sort of the same animal. It's super beneficial. And especially when you're going in and it doesn't look possible. You don't think you could do it, but to be kind of introduced to people who are doing it, and they have improved their quality of life. And so if we're doing it there, then maybe, and I looked to see if there was any facility who was making a real effort here, but I couldn't see any, at least not on intake. Yeah. But again, it kind of tie back into the first question, in that there's a lot more data. There's a lot more autonomy that I think we're leaving on the table, and that there's good information coming out of that patient. I think when they're in that state, when they're just getting into treatment, they're very raw. Most people are quite honest in that part, because they're just out of gas. You're emotionally exhausted. You're spiritually wrecked. You just have nothing left to hide, really. And so most of what you're saying is going to be pretty close to how it's going to be pretty close to accurate.
Yeah.
So, I mean, if somebody's telling you, I tried this before, I tried that before, didn't do anything for me. Can we try something else? even, just having a little bit of autonomy, or like in your case where you were allowed to stay closer to your son as opposed to being sent halfway or right across the country. Those things matter.
Yeah.
So I just wonder to what extent, and would you start to see, I think you would at least have the opportunity to gather data that's it's more concise, right? Because if you're just studying the cocaine group at whatever treatment center that's doing these specific treatments, you've got counselors, you've got people who've been working there. They start to learn about cocaine in a way that nobody else really knows. They would become specialists in that particular arm of addiction.
Yeah.
And you would have to think that as their experience grew and as data increased, that would translate into an actual measurable effect at the end. Could be wrong, but it seems like something that might be worth a try.
I agree with you completely.
And I know it's in the traditional model, to say that is relapse behavior.
Yeah.
Literally relapse. If you said something like that at Homewood, they would tell you to be quiet or settle you down. And after class, they would say, look, you can't be talking like that. It's relapse behavior.
What would the justification for that be? Like, why would they? Because why?
Because you're not being accountable for that's the drugs talking. Like, the idea that you could solve a drug problem and not have all the rest of the problem still. Like, there's no such thing as walking in to that place and saying, you know what, I've partied my whole life in and out, sometimes more, sometimes less, seem to be able to do just fine with it. But I ran into this one substance and became completely, I lost control of the situation. They don't want to hear anything about that. They want you to say, I've lost control of my whole life. If you present me with any kind of drug or mood altering substance, I'll just grab it and take it like a lunatic.
Gobble it up.
Yeah, gobble it up, because I have no control. So they want you to give that control up. And if you attempt to display some kind of an attitude that suggests you are able to control one drug and not actively worry about other things, or that one is easier to control than the other, then that's madness to them, right?
Yeah.
So,
which is just, yeah. It's just not the case.
Yes.
And it's not the case. And it's and it can also be that, we're on the brink of getting into a whole other discussion here then about the AA model and that kind of thing. But I think all of the people that I have met have been able to maintain a level of control very well for a period of time.
Mm.
And it was just life circumstances that changed, and stresses that changed and built up, and umpteen factors that impacted that ability to kind of stay the course for a period of time or not.
Yeah. And it absolutely deserves saying that there are people out there who the situation for them is where they abstinence is the only way, because they fit that bill, they fit that description. They are so interested in altering their perception that they will use anything at hand. Those people exist, but they're not nearly as common as what we've kind of been told, right?
Sure.
So why is everybody being treated like that?
Yeah.
I don't know. Again, I think it's more barriers to quality data we could be taking data out of these places left, right, and center that's being left on the table.
Yep, absolutely.
Was there anything else that I had to say about that? Well, yeah, no, I mean, I just, like I mentioned with Caduceus, it was, I think the Caduceus groups for me have offered much more. It's easier for me to connect. It's easier for me to lean on my peers, and I have more trust in them because it seems to set up a framework of support faster if you're generally aligned in a few, like your vocation matters, what you do for work matters. If you're a professional and the other person is the same professional, that seems to matter. Gender doesn't seem to matter too much, at least not in the Caduceus peer group setting. But I think there's also something to be said for people's cognitive abilities and people's economic situation. If I was in treatment with a wide range of people in that aspect, right? We had people. We had a guy there who was so heavily medicated, he didn't know what planet he's on. He's in treatment. Treatment for what? This guy is literally drooling during the presentation or whatever. I understand they're trying to get him through, but come on, like the guy has no chance, right? And yet he gets charged the same and processed the same, and it's weird.
At the same time, and I agree with you. In our Caduceus meetings, there are lots of common threads there, and the drugs of choice are oftentimes pretty similar. In some of the other meetings I attend, like smart recovery meetings, it's much more broad, and you'll get they're also larger meetings. You'll have, say, 30 people in it, so you have a very interesting breakdown of different people and from different walks of life with different backgrounds and different drugs of choice. And it's a fascinating conversation to find commonality there and to find things that similar lived experiences or similar struggles that people have. And that's one of the enjoyable things for me, is to see how different walks of life undergo the same hardships. But you get something different from each. I think you get something different from making those bigger connections, and then you get something different from the safety of a group of like experienced people as well. Whether that's in a support group model or in a like a treatment center model.
Yeah, I agree completely. Even with the part about like sometimes I'll go downtown here in Kelowna, and I'll just go down to there's a couple streets that have a lot of people with mental health issues, or homeless people, or people who are otherwise not participating in society as the general population is. But I like to go down there and just kind of see what's going on, talk to them, and what brought you here, what are your circumstances now? Yeah. What are you finding that anything that's being are any of the policies on a municipal or a government level, or are they doing anything for you? What's real, what's not? And those people, they have very interesting backstories, lots of them. And it's definitely, I actually thought for a while there, we might try to do something like that down the road, where we pose some kind of a change or a question, or just maybe we go down there and chat to people, like just to, pick a person. If they're willing to chat, we chat with them for a bit and, buy them a meal, whatever. Yeah. But that different perspective can be, it can get you set in another direction really quick, because it's easy to get pigeonholed, especially doing what we're doing, where we're always dealing with the healthcare system and same kind of problems and stuff. But there's a whole other world of issues out there too.
There is. And I think being aware of that is healthy. Mm-hmm. Absolutely. Yeah.
Yeah.